So our first horse is an older thoroughbred, 7-year-old thoroughbred horse, an older horse that's had 25 starts, which is quite a lot of starts, but probably not for a horse of that age. Interestingly, it had scintigraphy 4 years ago for quite a decent 3 out of 5 left hind limb lameness. It was negative to a low 4-point, but responded at that point to a tarsometatarsal block. A diagnosis of proximal suspensory desmitis was made based on having very hot proximal plantar third metatarsal bones. Now it's come in 4 years later, it's lame in the other leg, the right hind, and it swaps to a left hind with a low 4-point block. The horse has had radiographs and no changes were observed on those. Here's the scintigraphy from 4 years previously, remembering it was lame in the left hind then and had uptake, which we've cut off on this image, but it's now lame and blocks to a low 4-point in this leg, and you could argue that there's some subtle uptake in the Palmar aspect of its third metacarpal condyles there, but it's not very exciting. Right hind here again. But now on the CT, we've got this area of lysis here in both the lateral and the medial condyles surrounded by sclerosis. Joint surface relatively intact. This is the oblique dorsal plane I was talking about, and this is this view here that we take that gets us perpendicular to the palmar area where a lot of the action is going on, and you can see we've got biaxial subchondral bone resorption with surrounding sclerosis. We don't have the sclerosis extending into the parasagittal groove area in this horse. So we have biaxial Palmar Osteochondral Disease, and we don't yet have the articular surface collapse in this horse. Just to show you what we're seeing, this is a micro CT of a similar type of lesion from post-mortem. This horse does have collapse of the articular surface. You can see the microdamage here, which may or may not be visible on CT. This is a reasonably large crack, but notice the resorption that we're getting. So that's what we're seeing. This resorption here is the underlying resorption, and we generally see this underlying these areas of microdamage in a focal lesion like that. It's relatively focal, the resorption, and you can sort of appreciate that there's slightly less density in the bone there as well. But then we also see these more widespread lesions. So this one is a more severe in that it's got a crack that's running across, but you might have just generalized microdamage running across. And in those cases, the lysis is more spread out and so less concentrated than it is in these more narrower lesions that we see. But again, you'll see this sort of on a CT, it won't be as clear, the lysis, but it will be there, and it will be more generalized when you've got the microdamage extending further across the joint. So that's just typically what we see in a Palmar Osteochondral Disease case. And this case fits with what we know from the data out of Hong Kong, that it tends to be associated with more career starts and longer careers and more galloping, and is less severe in our younger horses that have done less work. And there's the typical appearance at post-mortem of the collapsed articular surface and the surrounding articular the surrounding cartilage damage that we see with them.